Welcome to Asian Hair Restoration Center Hair Loss Talk, where the first Filipino-American board-certified hair transplant specialist and a dermatologist, Dr. Julieta Peralta Arambulo, addresses the needs of our patients experiencing hair loss, providing the best medical, non-surgical, and surgical hair treatments for affected men and women in the Philippines. Joining her are our physician associates, both board-certified dermatologists of the Philippine Dermatological Society, Dr. Julieta Cordero and Dr. Leanne Songco, the authority in hair loss management and diagnosis.
Hi everyone, welcome to our first Hair Loss Talk episode. I am Dr. Julieta Peralta Arambulo.
Good day, I am Dr. Arambulo Cordero. So happy to be here with everyone.
Hi, I am Dr. Leanne Songco. It's a pleasure to be here. Thank you everyone for joining us.
This initiative is created by our team at Asian Hair Restoration Center because of the increasing demand from the public. And we hope that through this venue, we give you all the proper information and ethical education on what to do when you are experiencing hair loss.
As Dr. Arambulo's associate, I have witnessed her dedication and passion to be able to help our patients, counseling them, patiently explaining to them their hair loss condition causing the problem, and the treatment plan that will work best for every patient. Some even insisting that hair transplant na agad.
Yes, that's true. Online, maraming nagtatanong sa Facebook, Instagram, Asian Hair Restoration Center kung magkano ba ang hair transplant. Hindi naman kasi lagi hair transplant ang solution sa hair loss. Ang hirap din sagutin online kasi mahabang discussion with the patient. Ito po ang dapat niyo maintindihan. But through our series of talks, we hope to help you, but still, if persistent ang hair loss problem niyo, kailangan talaga ang consultation with a board-certified dermatologist for proper diagnosis and get the best treatment for prevention. Ito po ang pag-uusapan natin sa episode na ito. It is the purpose of our talk to answer all the questions of patients experiencing hair loss, especially for those who do not have the time to consult. So kung ikaw ay nalalagasan ng buhok, kanina ka ba nag-consult? For your information, merong hair loss specialist doctor. If you have consulted already, may mga gamot ka nang in-apply sa scalp or you have been taking medications, pero patuloy pa rin nalulugas ang buhok mo. Dati may improvement pero biglang nawala na ang bisa ng gamot. Ano ngayon ang dapat mong gawin? Hair transplant is not always the solution. But if hair transplant is the solution, this is another topic na dapat abangan. Yung mga interested patients seeking hair transplant, do you research, be educated first before choosing a surgeon? At kung ikaw ay nag-hair transplant na at hindi ka masaya at walang nangyari, nagkamali ng desisyon, may pag-asa pa ba? Ano ba ang misleading advertisements sa hair loss? At marami pang katanungan maaaring meron kayo. So dito sa Asian Hair Restoration Center Hair Loss Talk, naging madali para sa akin at sa amin ang magpaliwanag at sumagot sa mga katanungan ng mga pasyente na nalulugasan ng buhok.
So for continuous information and education about hair loss, please like and subscribe. So for our first topic, we will be summarizing for you the most common hair loss problems that patients encounter and whether or not these conditions can be treated. So Dr. Arambulo, if I may ask, why this topic po and not hair transplant kaagad?
I practiced dermatology way back in 1999. So malawak na yung exposure ko sa mga patients na suffering from hair loss and how they're being affected by it emotionally. Unfortunately, some patients, because of lack of information and education, were misled by media advertisements that bring them confusion in their decisions. Some underwent surgery when it was not needed, and those who needed surgery had good results that are devastating and irreparable. What will patients do when they have these problems?
So again, if you're experiencing hair fall or hair loss, it is our hope that we contribute in understanding how to choose a good, ethical doctor that will help you with your hair loss problems.
So please stick around until the end of the talk, like and subscribe. For now, I will give you the summary of the different hair loss conditions while Dr. Mariel will discuss the recent treatment updates of each condition. So hair loss is actually very common and can be quite distressing. And according to the American Hair Loss Association, by the age of 35, two-thirds of men will have some degree of appreciable hair loss. And by the age of 50, approximately 85% will have significant hair thinning. Although much lower for women, studies have shown a prevalence of hair loss as high as 32% among those more than 20 years of age. So different types of alopecia call for different treatment approach. And alopecia is actually just an umbrella term for the different kinds of hair loss, such as androgenetic alopecia, alopecia areata, telogen effluvium, traction alopecia, scarring alopecia, and there are also some hair loss brought about by infections like fungus and other skin conditions that will need dermatologic consult, especially if persistent.
So as a board certified dermatologist, we become the authority in skin and hair management. Continually.
So first condition is alopecia areata. It is an autoimmune disorder and majority of this condition is brought about by stress. It usually results in unpredictable hair loss that commonly appear in majority as patches or baldness of the scalp. And in some cases, it can be more extreme, leading to complete loss of either the scalp, called alopecia totalis, or the entire body, called alopecia universalis. This can affect anyone regardless of age and gender, but the good news is some fully recover without treatment. However, others may be more persistent and would warrant treatment.
So I see this a lot, and most of the time, I think stress is a big contributor, especially to the young. So alopecia can sometimes have a spontaneous remission. That's why you don't need treatment, but it can also have a chronic relapsing course. So there is a treatment algorithm for alopecia, but kapag isang pocknut lang or it's isolated, usually the gold standard is a steroid. So it can be intralesional or topical. I actually did a study on alopecia areata during my residency, and this was using platelet-rich plasma versus the gold standard, which is triamcinolone or steroid injections. So they both showed good results, but the PRP injections or the platelet-rich plasma showed lasting results after more than 3 months. Again, steroid injections or topical high potent steroids are the gold standard in isolated lesions. So I remember, Dr. Alian, that you did a study on alopecia areata also when you were a resident. So what was it and how were the results?
Yes, so I actually did write a study, that's correct, when I was a resident comparing the benefits of plain topical steroid versus topical steroid with an adjuvant narrowband UVB phototherapy. And my study results showed that there was more hair growth for patients who underwent the combination treatment.
Wow, interesting studies. So again, alopecia areata, though temporary, may recur again for severe condition. It's best to treat. Narinig nyo, mayroong injectables, mayroong topicals, they're all successful. But still, importante sa mga pasyente na mag-consult. So Lian, what is the most common cause of hair loss naman during this pandemic?
Doctora, that would be telogen effluvium. So the telogen effluvium is a form of temporary hair loss that usually happens due to medical conditions like your anemia, thyroid problems, or even crash diets, and sometimes medication intake. It may also be brought about by stress, shock, or post-traumatic events, such as during this time of the pandemic. So it may be caused by COVID disease itself, or maybe indirectly from fear of pandemic or loss of job, etc. Now, in telogen effluvium, large amounts of a person's hair might fall out, but the good news is it is often temporary and the hair usually grows back.
So the treatment for this is to always educate the patient this is temporary hair loss problem. So as long as you know the inciting factor, as mentioned by Dr. Elian, pregnancy, crash diets, or after a disease like COVID, your hair will grow normally afterwards. Just be patient. But to those who want treatment right away, usually in Asian hair, we give them oral supplements. And usually these patients, they already know what kind of supplement. And yung pinakasikat is biotin. But in fact, there are other vitamins and minerals involved that can cause hair thinning or hair loss. Even actually protein inadequacy can cause hair thinness. So in topical or even shampoo, we also give our patients anything that has minoxidil, but that because that is the gold standard and it's FDA approved. But again, if you're having hair loss problems or hair thinness, best to consult a dermatologist for a proper hair regimen.
So sa practice din sa Asian Hair Restoration Center, usually yung mga patients na severe talaga yung Telogen effluvium, matagal na. No? So we offer also the PRP with good results. But this is going to be another topic. So about hair, how about hairstyle, Liam?
Doctor, so hairstyling can actually also lead to hair loss. That is called traction alopecia. And it is caused by putting too much stress on the hair through repeated pulling or stretching, more common among women who wear their ponytail, buns, dreadlocks, hair extensions, or braids too tightly. And in time, the continuous pulling can damage the hair follicles. So if the damage due to the pulling persists, this can sometimes lead to permanent hair loss.
So the treatment for this attraction alopecia is just remove the inciting factor. So stop the habits of tight ponytail or dreadlocks. That's why it's common in skin of color because of the dreadlocks, repeated pulling or stretching. But this is different from another hair disease, which is called trichotillomania, which has a psychological factor. So, Dr. Arambulo, you have a lot of patients with traction alopecia or trichotillomania, right? And
Yes.
what is the difference?
Yeah, yung sa traction alopecia, usually yung mga mothers, di ba, they want to, yung tinatay nila yung mga buhok ng mga anak nila. So then they'll come to us, bakit manipis daw yung hair na sa harapan. So really, because of prolonged traction, nasisira yung hair follicles. So it's good to this episode is important also to educate the mga magulang na yung mga hairstyling ng sa mga anak nila yung masyadong pag ponytail.
Yeah, yeah, Dr.
Destroy.
Aaron, not only mothers, but patients who like to work out. Yeah,
Yeah,
has
so
tight ponytails. I saw rin eh.
talagas. So but kailangan may stop yan para hindi masira yung hair follicles. For trichotillomania naman, anak, usually ito yung mga young patients that's in the worst. Talaga yung yung mga bata na talagang they have the habit talaga na pinupul nila yung eyebrows na to the point na wala nang eyebrows yung mga bata. Ang fear here is baka hindi na mag-grow ang eyebrows nila. So usually this is the severe condition of trichotillomania, and we co-manage with the patients. We refer to psychiatrists to help us identify the underlying stress or trigger to this condition. So what is the most common hair loss problem naman, Lian, we encounter as a dermatologist?
Doctora, so the most common hair loss problem we encounter in our practice is androgenetic alopecia, and this condition affects both men and women, and it's also actually known as male or female pattern hair loss. Men are commonly affected, and this condition often leads to complete or partial baldness, presenting with a pattern that is easily recognizable in patients afflicted. Now, women are less affected than men, and hair thinning for women manifests as widened gaps between hair strands, and the hairline doesn't necessarily recede, and she is unlikely to become totally bald versus male patients. So genes and hormones like testosterone play a role in causing androgenetic alopecia. We will give a more detailed discussion about this on our next episode, so kindly tune in. Now, Dr. Mariel, would you kindly let our viewers know how we treat this condition?
So currently, the only FDA-approved medications for androgenic alopecia are topical minoxidil and oral finasteride. Low-level light therapy are also FDA cleared for use in male pattern hair loss. But there are other off-label options, including oral dutasteride, topical finasteride, oral minoxidil, which are not available in the Philippines, and platelet-rich plasma. We use the growth factors from your blood, and we adjunct it with microneedling, and the newest modality in Asian hair, which is regenerativa, which uses regenerative cells or progenitor stem cells on your scalp, and this stimulates hair growth. All these treatments stimulate hair growth. However, only finasteride blocks the formation of the main culprit, which is DHT or dihydrotestosterone. This will be discussed in the next episodes. So all of these I mentioned are all temporary, but if you want permanent results, hair restoration surgery is for you. So it can be costly, but it can cause dramatic results and involves two techniques, which is the follicular unit transplantation (FUT) and FUE technique, which is the newest one. This will be discussed in detail in the next episodes.
So now that you already know the different causes of hair loss, which conditions are temporary and permanent, and you have confirmed that you have any of these problems and want to understand more, seek help from a board-certified dermatologist, a hair transplant specialist as early as possible for prevention and management.
So join us in our second hair loss talk, wherein we discuss more in detail androgenic alopecia, who it affects, and when to start treatment.
So again, we hope you learned from our first episode here at Asian Hair Restoration Hair Loss Talk. If you have any questions, kindly feel free to write them down below and we will gladly answer them for you. But this is all for now. Please don't forget to like and subscribe, and thank you again everyone for watching.